Traditionally, pain has been thought of as a single entity with a one-size-fits-all model. But now, thanks to a lot of recent research, we know that that's actually not the case, and that there's different modalities of pain. And that means that there should be different treatment programs for it too. Acute pain is pain that happens at that time and in the couple of weeks following a particular injury. And that can include things like breaking an ankle or pain you experience after an operation. Chronic pain, on the other hand, is defined as pain that occurs for more than 6 weeks after the site of an injury, the time of an injury, or indeed after you'd have expected that time of the injury to have healed. And chronic pain can be divided into neuropathic pain, which means the pain is related to the nerves, or nociceptive pain. People with neuropathic pain classically describe features such as sharp, shooting, burning, and often they have a hypersensitivity of their skin. Their skin's very sensitive to touch, and it can feel like you're experiencing flu symptoms all the time. Nociceptive pain is often more throbbing, aching, and often of a musculoskeletal nature. It's quite possible though to have both together. Traditional painkillers like opioids and the non-steroidals and paracetamol don't often work that well for neuropathic pain, and in fact is often not the right thing for patients to take. And so for neuropathic pain, we would recommend a patient has a trial of an antineuropathic. And the antineuropathic medications are often divided into two categories, the gabapentinoids or the antidepressants. Although they're called antidepressants, they're not used to treat depression in the way that the gabapentinoids are not used to treat epilepsy. All of these antineuropathics, however, do contain side effects, and so we have to be quite careful when we pick a medication for a patient that the side effect profile would best suit that patient. Not everybody suffers side effects, but it's important to be aware of. And these are important things to discuss and consider with your healthcare professional when deciding which painkiller route to go down the route of.